Morning exercise science, part 2 lecture for chapter 12, cardiovascular system. You can see behind me on the board is a diagram of the heart. This diagram is included with your notes. So if you have the ability to print it out, or if you don't, at least you can refer to it. As I mentioned in the last lecture, this is not an exact representation of what your heart looks like. If I cut your heart in half, it's not going to look like this. The walls are much thicker. This is a schematic representation so we could show the pattern of blood flow through the heart. In fact, the right and the left sides of the heart, as I mentioned in the last lecture, although they don't intermingle with each other, they're kind of wrapped around each other. So this is a flattened out, ironed out version, just with straight line drawing. And again, the whole purpose of this, and I'm going to say this now before I even go through what I'm about to go through, is that you understand the pattern of circulation through the heart. That is the most important thing that you could take from this chapter, from this lecture, and into next year and into your future careers. Nobody is going to ask you the difference between the pulmonary semilunar valve and the aortic semilunar valve on any test that you're going to take, and unless you become a heart surgeon, it's not going to be extremely important. But to understand the pattern of blood flow, what the right side of the heart does versus the left side of the heart, where the blood's coming from, what condition it's in, is extremely important. So keep that in mind as I go through this lecture today. Try to follow along as best you can. This is outlined step by step in the notes that I provided on Google Classroom, so I don't know if you can have those open at the same time, or again, have another copy somewhere that you can kind of follow along, because I'm going to go through this relatively quickly. And it's saving time. I don't need to upload a 30-minute YouTube video. So watch this and try to follow along with your notes, or watch it a couple of times, whatever you need to do. So the first place we're going to start, and again, since it's a circuit, obviously the blood follows a circuit throughout the body. There's no start and there's no end. The easiest place to start is the right side of the heart as the blood's entering. So we'll start over here. I'll do the best I can to talk loudly as I go over here. I'll probably repeat myself a few times just to make things clear. So blood's going to enter the heart here and here. And notice that I'm using blue arrows. Blue's meant to represent low oxygen blood. The blood is not blue. It's a darker red than the blood that's going to be the other side of the heart, but it's not blue. But blue's easy to kind of remember and understand. And this is the right side of the heart. It doesn't look like the right side of the heart as you look at it. It's the left side of the heart. But remember, as we look at anatomical structures, you are viewing them as if you were looking at somebody else, like me. This is the right side of my heart. So this is the right side of the heart over here. So even if you want to label that in your notes right now, or I can just put a quick label up here. So when the blood comes in, it's going to be in a condition where it is low oxygen and high CO2. And this is coming from the body. So all the body's tissues, everything we've learned so far, this should make perfect sense to you. We've taken the blood, we've pumped the blood around the body. The cells have taken the oxygen that they need for nutrients, obviously for cellular respiration, to release energy. That's why we need oxygen. That was one of the questions on your last test. The blood provides that. The heart pumps it. And now the cells are going to kick out their waste products. They're just like little autonomous structures. They're houses on a street. They have garbage, right? Carbon dioxide is some of their waste, and that also comes from cellular respiration. So we bring all this blood back from the body in these two vessels. This is the inferior vena cava. The one on the top is the superior vena cava. They're going to drain all the blood from the entire body. And that blood's going to go into what is called the right atrium. All right, I'll label this RA here so you can see this. All right, the atrium contracts. It is a chamber in itself. Remember, there's 4 chambers in the human heart, 2 atria and 2 ventricles. The heart's going to contract, and it's going to send blood into the right ventricle. All right. In the process of going into the right ventricle, it passes through a valve. The function of a valve is to prevent backflow. So when the heart beats again, because remember the atria and the ventricles are going to contract in a stepwise fashion. That's why your heartbeat is a 2-step contraction. Bump, 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 bump. The first bump are the atria contracting. The second bump are the ventricles contracting. So when the ventricle contracts, you do not want to force blood backwards. That would be counterproductive. In fact, that would be very dangerous. You want blood going in one direction only. So that valve will snap shut as soon as the ventricle contracts, and it'll force all the blood up this direction. So when the ventricle contracts, the blood is going to go up through here, through this set of valves, and then out through these two vessels. Now, I just said a lot in about 2 seconds, so if you can kind of follow along real quickly. The name of this valve right here is the pulmonary semi-lunar valve. Pulmonary, meaning lungs, semi-lunar, looks like half moon, it's two flaps, valve. Now, the two vessels that are leaving the heart at this point, the right side of the heart, are called the pulmonary arteries. These two right here, pulmonary artery, there are two. There's one going to each of the set of lungs. Now, these are the only arteries in the body. By definition, our artery carries blood away from the heart, so that's exactly what's happening. We're leaving the right side of the heart, but they're the only arteries in the body, system of arteries in the body, that carry blood that is low oxygen and high carbon dioxide. Now, what happens to the blood when it leaves the right side of the heart? It goes to the lungs. And what happens when it's in the lungs? And again, I don't want you to visualize your lungs filling with blood. We're talking about capillary networks that surround the lung tissue. They're little air sacs called alveoli. And those capillaries are so thin, 1 cell thick, and so are the alveoli, that gases can literally diffuse through their walls. So what will happen when we pump this low oxygen, high carbon dioxide blood to the lungs, the lung tissue, is that the oxygen that you've just inhaled with your last breath will pass into the bloodstream, and the carbon dioxide, because the blood here is high in carbon dioxide by diffusion, will pass out of your bloodstream into the lungs so you can exhale it. This is a very important process. It's called gas exchange, and that's what happens here. So we are going to the lungs for gas exchange. I'm going to try to write this in here as best I can. Gas exchange, very important term. And the process that occurs is by diffusion. And I'm running out of room, so I'm going to have to erase when I get to the other side of the board, which is fine, on the other side of the heart. So those few words that I wrote there, gas exchange by diffusion, super, super important. Super important that you understand what that means. Again, we are taking blood. We're going to pump all this blood that came from your body to the tissue around your lungs. We're going to have gas moving into the lungs, that would be the carbon dioxide, and oxygen moving out of the lungs back into the bloodstream. Now, obviously, we have to bring it back to the heart, because now we've charged the blood again, so to speak. We filled it up with oxygen, got rid of all the carbon dioxide, and we need to bring it back to the left side of the heart. And we're going to use a red marker to show that. All right? So what's happening here? We have high O2, low CO2, blood from the lungs. And if you look at a diagram of the thoracic cavity, what you'll see is that the heart is kind of nestled right between the two lungs. So this is not a long trip. So the right side of the heart doesn't have to be super powerful. That right ventricle, when it contracts, it's just going to be forcing blood into that diffuse network of capillaries that surround the lung tissue, so gas exchange by diffusion can occur. Once that happens again, we're going to bring it back through these two vessels. Now, again, we talked about the anomaly on the other side of the heart, the pulmonary arteries, carrying the only arteries in the body that are going to carry low oxygen, high CO2 blood. These are pulmonary veins. By definition, a vein brings blood back to the heart. When it brings blood back to the heart, in this case, they're the only veins in the entire body that carry high oxygen blood and low carbon dioxide blood. So again, you have to visualize this. It's not just two tubes, two veins, two arteries that are going to carry it to the lungs. They're going to branch off, if you can visualize the branches of a tree or the roots of a tree, two large trunks that branch off into microscopic capillaries, millions of them. So all those millions of capillaries that are coming back to the lung eventually are going to enter the left side of the heart through two large veins called the pulmonary veins. Once they get there, we are now in the left atrium. All right? The left atrium will contract, and it's going to send blood into the left ventricle. The left ventricle, if you look at them, if you actually look at a heart, and I wish I could do that for you, the left ventricle is more robust. It's larger, it's more muscular than the right side, which makes perfect sense because the left ventricle is responsible for sending blood to the entire body. Cells in the top of your head, the tips of your toes, that side of the heart is going to be responsible for getting blood all over your body as opposed to just the lungs, which is the right ventricle's responsibility. All right, so back to our trace. Left ventricle contracts. We pass through another valve system here. That valve is called the aortic semilunar valve. The aortic semilunar valve, oh, by the way, I missed a valve here. Tricuspid's on this side. Bicuspid is on this side between the left atrium and the left ventricle. 2 flaps, 3 flaps. It's also called the mitral valve. Mitral, M-I-T-R-A-L. You'll hear that actually refers to that more commonly, and it's something that you'd have to be aware of if you had a patient that had mitral valve prolapse, which means a leaky or faulty valve between the left and atrium and left ventricle. Usually they're repaired surgically, but sometimes they are asymptomatic and something, again, you need to be aware of because it is a heart condition, especially when you're exercising a patient. All right, so anyways, blood passes to the left ventricle through the bicuspid valve. It's going to go through the aortic semilunar valve, which is the valve right here. And then it goes into what's called the aortic arch, or the aorta, which is the largest blood vessel, largest artery in the body. You can see on the top of the aorta, there are 3 vessels. Those 3 vessels are going to supply the body's tissues with high oxygen blood. Those tissues specifically being the ones in your arms, your shoulders, your thoracic cavity, and your head. And I'll talk about those with you a little bit more, what specifically they are, but right now, for time's sake and for clarity's sake, I'm not going to go into that. So again, if you want to draw lines on your own, and I'll erase this here for now, you're going to have some blood that's going to be going to the body. And it's high oxygen. Obviously low CO2. Right, the remainder of the blood that does not pass out through those 3 vessels, is going to wrap around the back of the heart through a vessel, and I can't draw this here, just imagine that this vessel continues, and then you can see it come out here on the bottom. And this makes perfect sense as well. This is called the descending aorta, descending, going down, and it's going to supply high oxygen blood to all your lower extremities and your abdominal pelvic cavity. So your intestines, your stomach, your liver, your spleen, your legs, all are going to rely, your kidneys as well, another one to throw in there, rely on a blood supply coming out of this aorta. Obviously, it branches into multiple different named arteries that supply specific places, but for, again, our purposes right now, just understand what this is. Now, so I just threw a ton at you. This is something I typically spend 2 days in class lecturing. We go through this step at a time, which I just did. Make sure you look through your notes. I'll ask you some questions that are going to help me assess your ability to understand what I just asked you here. Big point. Right side of the heart sends low oxygen blood, high CO2 blood to the lungs so it can get oxygen, drop off its carbon dioxide. It's collecting low oxygen blood from the body. The left side of the heart is collecting high oxygen blood from the lungs, and it's going to send it to the entire body. That's the big point to know. All right, have a good day.